how open to that are the students and the parents. We had really knew there was a need, and we were struggling to fill that need in person. And so this kind of came along at a really good time. And so really the first things were, how do we make that happen? Are the parents going to be on board? Because this is a different approach. And will the students really interact effectively? So those were the biggies. More logistical, I think, than anything else. Our community health worker that we brought on board with this project did some additional supportive services with the school staff and the behavioral health provider. And she participated in teacher workshop days and parent nights and things of that sort, and sent information home as well with the students. So we did a lot of building up, I think, of this opportunity or this potential resource before we really got started. And Carrie, again, had done such a great job of making herself a part of the fabric of the school. Even where we chose to put her office, I think, was also key to that. We talk frequently. We talk about, how the schedule's working, any changes that are coming, what the new provider might be looking for, where we stand with, reimbursement questions and things of that sort. We have had great support from the school. Grant program itself has been supportive of needs and questions and concerns and responding to that really quickly and very positively, so that makes it easier. Routine communication among all participants, I think, is also really important. We have worked together to identify barriers or bottlenecks, and how do we solve that? And so I think that the key is just being a team. Any one person trying to solve it alone is not nearly as effective. And indeed, we have a behavioral health provider who provides this service, telehealth, who is just doing a really wonderful job. She's done very quickly and easily was able to integrate and make herself also a part of this program on a daily basis. And our community health worker, Carrie, again, because she supports the school here in so many ways, outside of just these telehealth visits, she has become a really trusted and primary resource, both for me, but also for everyone at the school. So that kind of partnership and teamwork, I think, is key. To just kind of show up in a new environment without having built that first, I think would be super challenging. From a basic program operation perspective, there's not a lot of change. How we process a referral, how we review any potential insurance coverage or access to grant funds, how we set that up at the school and manage the student schedule along with the clinician schedule is all pretty much about the same. The bonus, though, in this new process with a full telehealth person is the availability is far greater. Our in-person provider that we had was able to only be here a few hours twice a week, and so that limited our availability, and she carried a patient load elsewhere. So while our telehealth provider does too, there's no travel. I think it's been easier, but the process really hasn't changed immensely. The things that I think have made it successful are the traits that person did bring to the job, that we may have recognized but didn't put a label to it or didn't say it out loud. And so our CHW comes with some background with working with kids, having done some coaching work and working in a school setting in the past. Not their primary role, but having interest, desire to make a difference, and integrity. Because this position in the school setting is somewhat self-directed, I think it's also important that somebody can be kind of self-motivated. Take direction, but not need constant high direction. Be able to communicate even when it's difficult. We moved towards that 100% telehealth model. And we had some reservations. It's gone very well, like very well. Our providers comfortable seeing children as young as 6. We would say that surprisingly, the telehealth model has been very effective, and everybody seems to be quite pleased with the outcome. We have more kids able to get services than we did before as well, and that's a pretty big deal. I have 30 plus years of background in healthcare and at many different levels, and have supervised many, many people. But the CHW role was new, and so I did take the supervising CHW course. It would be very helpful, particularly if someone hadn't had a lot of experience providing any kind of oversight, because they offered structure and the how-to piece. Thinking about how we would integrate the cost for a CHW when at the end of the program, that would be one factor. The new clinician that we have, our telehealth clinician, that is a little bit a different approach, but the cost would have been there for an in-person as well. The technology would be the thing you really want to prep for, and the space. So working with your school that you're getting ready to work with, spending time. I actually came and walked around and we looked at space together. We talked about what we needed and what, from a HIPAA perspective, for a patient comfort perspective, would be best. Get to know the school, talk with them openly about what their needs are. Many schools have no behavioral health resources at all, and while they may recognize there's a need, they may not have ever really thought about it. The biggest challenge that I've come up against is managing that clinical staffing. I think that that's probably everybody's difficulty right now. Behavioral health services are pretty thin, and there are a lot of providers that are leaving the outpatient world for telehealth services. So that's added to the challenge for recruitment. Our little elementary school is quite a bit smaller than many, and if it were a larger system and the availability full-time, I think that it would be reasonable to say that could be a full-time week. We are able to help in managing a whole lot of social things, like we call them social determinants of health, but it's many things in our lives can affect our well-being. Not just your physical health, but your well-being overall. And so our community health workers are able to be kind of, again, part of that fabric in a way that they can see things that others might.